We are live.
And good afternoon, everyone. Welcome back for another installment of Power Half the Hour. I'm James.
I am Mike Willis.
I'm Jahi.
And we are Power Half the Hour here at Chase Brexton. And today, as everyone knows, is World AIDS Day, which is a very, very important day globally. And Mike, you have some information, a little introduction for
Yeah, a
us?
little bit. So this is the 32nd World AIDS Day ever. This is the first World AIDS Day was in 1988. Every year has a different theme. The theme of World AIDS Day this year is
Global solidarity.
global solidarity.
Yeah.
Okay. So I was thinking about what World AIDS Day means to me and how we can think about it. And I think there are a couple different ways. One way to think about it is it's a memorial to those people who've gone before us who, didn't get on therapy. There wasn't treatment then. That's one group of people I think about on World AIDS Day. The second are people who are living with HIV now, and despite living with an illness that is still highly stigmatized, there are plenty of people who are on therapy, living good lives, out and happy and glad to be alive.
Right.
Then, but now I think we can think about people who are working in the and personally working on prevention. People who, we have, PrEP now, which is pre-exposure protection. It's a medical intervention, a pill that people take once a day that keeps them from getting infected. And that's another way to fight HIV.
Yes.
And I guess the fourth group of people I'm thinking about are people who, aren't sure whether they're HIV positive or not. They haven't gotten tested. They're not sure where to go. They don't know if they want to know.
Right.
And then there's people kind of in that same group who know they're HIV positive, and for whatever reason, whether they don't have access to care or they're afraid, aren't getting treatment. And so I kind of think those four parts, those four factions of people we can look at in World AIDS Day and think about all those different groups and, send love to people who are, the people who have passed and people who are on treatment and people who don't know, and send love to the people who are, preventing themselves from getting HIV and stopping the infection from moving on.
Exactly. I agree with that. And if I could, I'd like to add a fourth group, the supporters, the allies that we utilize that help us out in this mission, like us as case managers, provide doctors, nurses, caretakers, home health aides, all of those people, even government agencies that supply the funding for betterment of intervention and prevention, like you said. So all of those components are definitely important, especially for today, that we take vision and focus on an epidemic that has impacted the entire world as a whole.
Yeah.
And it's very important that we recognize that, and I'm grateful that we have a day like today, World AIDS Day, every December 1st of every year, that we pay close attention to this epidemic that has impacted everybody's life, whether you have it or not. You know someone who has it, or you know someone that probably succumbed to it, or you know someone like us that works in the fields and everything. So this day is very, very important, and like you said, since 1988, so that's 32 years.
Yeah.
Not that we celebrate, but we recognize this day, and people that, like you said, people who have passed on who weren't able to get the treatments and everything, and that's why it's important for a facility like the one that we work in, Chase Brexton, and Chase Brexton, which has been around since 1978 or something, right, has been around and has dealt with the LGBT community for so long, because when it first started, it had a name, didn't have a name, people didn't know what it was, people didn't know how to treat it. Chase Brexton came in and set up something for the LGBT community that they can go to be comfortable, and we can handle it physically, emotionally, mentally, and medically
Yeah.
in dealing with the cases that was going on, and have a place where people can go and be assured that they can get the care need that they need, and here at Chase Braxton. So that also is a beautiful thing, and I'm grateful for everything around the world when people come together on this day. This is one of those particular days, like many other I don't want to say holidays, but many other important days that sticks out in the world, where the world comes together in unison and can agree upon one thing, and that's to stop the spread or end the epidemic, as another slogan for World AIDS Day is to stop the epidemic of the spread of HIV and AIDS. And like you said, having now PrEP and PEP, which are prevention medications and tools to help you stop the spread of HIV. If you're HIV negative, you can take the one pill every day, like we connected with like being birth control, right? One pill a day stops it from happening, right? And then PEP, we know that the 2-pill intervention, like the day after pill, if you was exposed within that 72-hour period, you can definitely go to a medical facility, tell them what happened. They'll check you out, prescribe you the medication, bring you back, check you, make sure there's no evidence of the HIV/AIDS virus, and then we can talk about transferring people onto PrEP. And that is very important, that message is out too in a war against HIV and AIDS. Is trying to get as many people connected to PrEP and PEP, because that too, in association with condoms, that people will stop the spread of HIV and AIDS. So it's very important. Jahi, your thoughts?
Yeah, I definitely feel that we've come a really long way with addressing HIV care. But then with COVID, there's been a lot of talks about how to continue that continuum of care, getting people engaged in care, and for individuals living with HIV, making sure that they're making their appointments and getting their medications prescribed. So it's good that we have like telemedicine, so that providers can still prescribe those medications, and we have like mail order delivery services so that clients can still get their medications. A lot of clients still want to get tested for HIV, but a lot of places are closed at the moment. So there's a lot of conversations about people getting rapid tests mailed to them, and still getting condoms mailed to them. So I think there needs to be more conversations centered around how can we maintain this continuum of care? How can we keep people engaged if they can't physically get to the office? So I definitely, want to talk more about that. Like, how can we keep people engaged when we're worrying about COVID?
Right,
So
and another pandemic,
Another
right?
pandemic. So how do you continue those conversations?
And I guess that something like a platform like we have here, that could be one way. Social media is so big now, right?
Yeah.
So we can definitely use the social media platform to continue to put that message out there and let people know what services are available to them. Because a lot of times when people come in for their appointments and stuff like that, they might not be asking the questions that they want to ask, or the thoughts that they have in their head. They just feel like, I'm coming in and get what I need to do, and I'm out. And sometimes, when you go to doctor's offices, it's a long wait before you get in there. So by the time you get in to see the actual doctor, you might even forget. But it's our job, like so many others, to continue to put out the message of the services that are available to people, and a lot of services that are at no cost to a lot of people, because that's another thing. People think, oh, I can't get it because of this, or I don't have insurance and stuff like that. Knowing the information and knowing where to go can provide you the resources to obtain the necessary tools you need to prevent HIV infection or to treat your HIV infection, and that's important that we do these lives and spread that message as much as we possibly can, and share it with everyone whenever we can.
And to do a little ad for Chase Brexton, we are still taking new patients. If you're HIV positive, call us, call and we will get you connected to care. Usually within you'll see a case manager, if not that week, then the week after, and we'll get you in for labs and to get an appointment with a doctor within 2 weeks.
Yes.
We still have walk-in testing every day between 9 o'clock and 4 o'clock. And we'd love to see you. We've got somebody on staff all the time.
In all sites.
Ready to test you.
In all 5 of our locations,
All 5 locations.
So we are here. We're on the battlefield.
We are. Every day
Every
at Chase
day.
Brexton is World AIDS Day.
Every day.
Let me tell you.
That is true. I like that.
Yes.
That is so true. Every day is World AIDS Day. The mission and the plan doesn't stop for us. You know,
No.
that is what we do. That's what we love to come to work to do because we love to help people. You know, and we also love to be educated on more and more ways that we can assist everybody out here. You know, and again, Chase Braxton provides that safe environment for people to come, whether you're gay, straight, bisexual, gender non-conforming, transgender. It is no prejudice here at all. No matter who you are, no matter what you have, you can come to Chase Braxton, and 9 times out of 10, 10 times out of 10, we got what you need to help you battle what you need to do. You know, we're a one-stop shop, and we say that proudly because we are. Sometimes you might be here for hours, but before you walk out that door, you're going to have what you need. And if you don't have it right then and there, at least you walk out with the confidence of knowing that Chase Braxton will get the job done for you. And I'm not saying that because I work here and I got a nice job, but you know what I'm saying? But it's the truth. It's really, really the truth. And I recommend Chase Braxton for all services because Chase Braxton has expanded so much over the years and provides services from the youngest to the oldest and from whatever you need, behavioral health, dentistry, nutritionist, medical. We have it all, and those are all components are needed to battle this epidemic that we're in. You know, and whether it's COVID or whether it's HIV, you know, you need all of those moving components. Right, you need all of that to do that. Yeah, definitely. Because that was a little bit more about how COVID is impacting HIV. Like, what have you read about that's more like how people compare it?
Yeah. In regards to just meeting up with people, you know, people have sex, you know, so there's a lot of conversations about just how to have safe sex in the midst of COVID. A lot of times we try to advocate knowing your partner's status before, you know, having sex and getting.
What status do you mean?
HIV, or sexually transmitted disease like HIV, even COVID too. So just when people are being intimate during COVID, just knowing people's status of COVID, HIV, other STDs, and having access to protection, and you know, can you pass COVID through like being intimate and things like that. So I think there's just a lot of conversation centered around how can you have safe sex during COVID, and just sex talk in general. Because still, even though we've come a long way with talking about sex, there's still a lot of stigma around sex. Just consent and just communicating what the person like needs sexually, and conversations about other sexual partners, like all of that is still, we need to have those conversations. And it's harder during COVID. Yeah. So definitely all of that is still important.
Very important.
Yeah.
And that's why here at Chase Braxton we honor those that have been impacted by HIV or COVID, and today being particular World AIDS Day, we honor those past, present, and future that have succumbed to this epidemic, and the people that work in it, the people that are in care for it. And Jahi will now read the names, some names from our wall.
Some
here
names
at Chase Braxton.
So just some names from the Wall of Carriage.
Wait, tell us a little bit about the wall.
So it's basically it's ways to pay tribute to those who were directly impacted. Either they passed away or had a family member that passed away related to HIV. So it's just a way to just kind of give them a face,
honor their memory.
Yep.
So what we have is we have these tiles that are throughout the building, and they're ceramic tiles, and what they have a person's name on there, and I guess they've probably been there since the beginning of 95, since 1995. We've been putting these, you know, people have been sponsoring these tiles with the names of people, as you said, who are directly affected by HIV, had it, or were affected by it.
Right.
So just a few names, not all of them. So David French, James Anason, John Steuben, Arthur Strotzman, David Rittner, Frank Osmond, Jay Hallbrook, Paul Fleming, Raymond Miller, Reginald Barnes, Stephen Amen, Alan Blackford, Anthony Thomas. Skip a couple pages. Robert Buffington, Paul Reese. Skip a couple more pages. We got a long list. Oh,
Just say the names.
there we go. So that's a few. Just a name.
Name some more.
Let me
Some
read
more.
some.
You want to name?
I want to
some?
read a couple.
I can read a couple. There we go. Tag team.
Richard Petaway, I knew him.
Oh, God bless.
Richard Baseman, Rob Dillard, Robert Kirby, Nathan Kolodner, Myra. There are some names on there where, you know, people were not comfortable having their whole name on a tile. They, even though they wanted to be remembered, they were a little, either they were apprehensive or their family. William Lowry, I knew him. Wayne Ardinger, Tom Harold, Ronnie Frum. Want to read some?
Mike Jensen, Milford Lane, Monique Moni, Musa, NM, excuse me, Nathan Caldor, Oliver Garner, Paul Barringer, you said that already, Paul Reese, Purnell, Philip DeFatta, Phyllis P., Rachel Burrell, Al, she got my last name, Ralph Flitwood, Raymond Holmes, Randall Aldridge, Randy Harper, Ray C., Raymond Dallas Haynes, Reginald Brooks, Rhonda Gray, Richard Rick Petaway, Richard Smith, Richard Baseman, Richard Baston, Richard Comby, Richard Lazarmanik, Rob Dillard, Robert Buffington, Robert Robert Kirby, William Lowry, William Gibson, William Keller, William Price, William Smart, William Talbot, Winfred Scott, Yadura, Yolanda Hall, Zeta, Ronald St. Thomas, Rodney, Roger Talbot, Ron Scooter Flynn, Ron S., Ronnie Foreman, Ruby Sparkman, Samuel Hopkins Jr., Sarah Reed, Scott Wilson, Shane Savage, Stan Nick, Stephen LaRocha, Stephen Kaufman, Sylvia Lynn, Ted Henry, Terry McGravy, the Don Miller House, Tom Harold, Thomas Diddy III, Thomas Menahan, Tim Tingler, Tom Miller, Tony Gova, Tracy Elliott, Chirella Jackson, Uncle Paul, Vin Livesey, W. Ross Milestan, W.G. Smokey Katz, Wayne Aldrin, Wesley and Wilbert George. And we speak your name. And we honor you, your friends, your family, and so many others that have been impacted or affected or affected by HIV. We honor your name and we say your name and we bless you. And we thank you for your courage, your determination, your knowledge, your fight, and your struggle doesn't go unrecognized and always will be remembered, especially here at Chase Braxton, as we continue to fight through this pandemic, epidemic, and everything surrounding it, that we can make life a little bit better for each person. And so we thank you today for joining us for our Facebook Live with the Power After Hour. We bless you all and we say come back again and check us out on our next topic.
Let's have a moment
of silence?
Yeah.
Yes. And so at this moment, we'll take a moment of silence for those that have been passed on and those that are still struggling and fighting this fight. That hit you, right?
Yes.
Because it did. It hit
Thank
me
you.
too. It hit me too. It hit me too. Thank you, everyone.